Hi, my name is Jennifer Snyder, and I have the PEDS group here today working in a mock sensory lab and getting an idea of what it would be like to be in a sensory clinic and better understand how they process sensory information. Our goal always is to help kids to participate and help them to thrive. So we want to help them to better process sensory information so that they're able to participate in their day-to-day tasks. And students can get an idea of what it might be like to have difficulty processing any one of these sensory inputs. So they're going to move from one station to the next, starting off with vestibular input, what clues they might see from a child who's struggling with processing vestibular input. And then they can move on to proprioceptive input, which activates our muscles and joints. And they can get a better idea of how they can grade their force to meet an expectation. And then they move on to the tactile station. And in the tactile station, they have an opportunity to interface with different kinds of textures. Some of them might be a little bit easier for some people to tolerate than others. And also think about if some of those wet or sticky textures are more difficult, how might that impact feeding, or how might that impact a child's participation in their day-to-day. And then we move on to auditory input, and they get an opportunity to feel what it might be like to be overstimulated by auditory input, and how for some kids, when they're in a loud environment, it's really, really hard to focus on anything other than a repeated noise. This helps them to have a better idea of what it might be like to work in a pediatric lab. They might have not had that experience, so getting an idea of how they need to think on their feet and what they would need to observe in children and keep it fun and playful so that kids feel safe and can really explore their environment and learn and grow.